We've had patients tear up and cry because they finally got the smile that they wanted their whole entire life. A lot of patients come in and they have issues with their smile, they're uncomfortable with the way that their teeth look. And for me to be able to positively affect that, for a patient to walk out of here, they come in with something wrong and they walk out with something nice, it's very rewarding. The smile is the first thing you put on every day. Invest in your future, invest in your smile. People ask me what my first experience was with dentistry, and at an early age, a dentist come to my 3rd grade class and do a presentation on oral health care. So I looked and thought, that would be a really cool job. I think I would like doing that. And I pursued that thought throughout grade school, high school, and college. To be honest, I really didn't know whether I would be okay with it. Probably 90% of my dental class went into this not really knowing whether we really would like this or not. As I got into it, I realized quickly that dentistry was for me. The ability to learn technical skills and to help patients and really make an impact on their lives in a positive way, that's the rewarding thing about dentistry. I did very well in dental school. I was able to graduate 2nd in my class. Graduating a little bit early, all my requirements to graduate I was done with by my junior year, and I was able to have an absolutely rewarding senior year, almost like a mini residency. I graduated from dental school. I quickly pursued even more education, and I did a general practice residency at Sinai Hospital of Detroit, where I was immersed into not only medicine, in oral surgery, endodontics, prosthodontics, and restorative dentistry. That 1 year of residency probably gave me close to 15 years of experience out in the real world. Why choose Elegant Edge Dentistry? We deliver compassionate care that's detailed and personalized to each individual's needs. We really try hard to focus on their needs, whether they be financial or concerns with the way that their dentistry looks, but we really try to take care of each patient and treat them holistically. I've surrounded myself with an amazing staff. The entire team here at Elegant Edge is focused on the health of the patient, getting our patients healthy. That's the one common goal that we all have here. We're not pushy. We help patients understand what their needs are through education, and we show you what the problems are in your mouth so that you understand why we want to treat them. One thing that I've tried to do is to not look at a patient individual tooth needs, to try to look at the patient as a whole person. And by doing that, we're able to really provide great outcomes for patients by detailing their treatment plans to their individual needs. Here at Elegant Edge Dentistry, we have a very high-tech office, and because of the technology, we are able to deliver care more efficiently, quicker, and we're also able to deliver it in a more comfortable fashion. And so I've been practicing dentistry for approximately 38 years. How I do things now is completely different than the way I did things when we first got out of school. We find out that things that we did before weren't really correct, so we alter the way that we do things in the future. I use lasers in my practice, and lasers help me do my job with less discomfort and more efficiently. Most dental offices that are progressive will have cone beam technology. It allows us to have a 3-dimensional image of the jaw and the whole dental complex, which allows us to see things that you do not see on a 2-dimensional x-ray. With radiology, we've gone to digital radiology, which uses about 80% less radiation. We can safely take x-rays now in a digital format, and that's a lot less radiation for patients. All these technologies and all these advances lead to safer dentistry and safer outcomes for patients. Our community involvement shapes our approach to dentistry because the community are the people that support us. We need to give back to the community. Our office is involved with the Mission of Mercy, which is a wonderful program that allows thousands of patients to come in and get absolute free care. It's probably one of the most rewarding things I've ever done, to give back to the community from the profession that's has given so much to me. Those patients are so grateful. We take care of the whole family here. Early age all the way to senior age. My advanced training in some of the pediatric cases that I've done in the past allows me to take care of a lot of pediatric issues, and also my training in orthodontics allows me to do some minor cases. It also allows me to realize that there are some more advanced cases that need to be sent out to specialists. Throughout my life, I've developed a number of hobbies and skills and things that I do outside of dentistry that really, I think, help me relate on a more personal basis with my patients. Water sports, gardening, farming, photography, travel, hiking, camping, hunting, fishing. It really is fun to kind of connect with patients because a lot of my patients have those same interests, and some of them have even some incredible stuff that inspires me to want to do some more things in my life. It helps me to be more relatable to my patients on a daily basis. I've had a number of patients over the years with cosmetic issues. I had a gentleman come in. He was not happy with the way his front teeth looked. He's a public speaker. We were able to manipulate and do some more advanced cosmetic procedures to improve his smile, and he was so happy because he's speaking out in public and he was a little self-conscious of the way his front teeth looked. It's very rewarding to be able to help somebody achieve a good smile. So our patients feel like they have a home here. We want them to feel comfortable. We want them to feel that we're not here just to make money. We're here to help them out. We're here to help them get their dental health back in shape. And every one of my staff is focused on that. And we take care of patients' individualized needs by focusing on what their situations are. Some patients come in and they are super terrified. We have a great way to kind of calm them down. We use anti-anxiety stuff, nitrous if we need to. And we even also offer IV sedation here in this office for those patients that are super fearful. But we're able to really deliver comprehensive care in a safe, comfortable manner by just focusing in on what our patients' needs are.